Well, happy Wind Down Wednesday, everybody. Thank you for joining us. Cheers.
Cheers.
We've got a fun group today and some fun stuff to talk about. Yay. We've got Melissa with us today. It's her first time on Wind Down Wednesday. And we are drinking a wine of her choice.
Yes, we're drinking a Riesling. I like this.
I'm teaching old dog new tricks.
I know.
A new wine that we haven't. I mean, I've drank Riesling, but just not on this program.
No, we haven't. Usually we're drinking reds or we're drinking something from Paso Robles.
Yeah, exactly. We're so,
our favorite place.
we're so
But thank you for recommending this. So
sweet.
You guys probably want to know what we're drinking. It is a Lucen Brothers Dr. L. Riesling 2023. It's nice and fruity. It's flowery. What else do we smell? I'm going to cheat.
Pears or pears?
Ripe apples. Candied fruit and flowers. Well, it's February. Let's talk about February specials because we always have some fabulous specials.
Well, first, say what's going on in February. What happens
It's
every
our
February?
17-year anniversary.
It's our birthday. It's our birthday in February.
Yep, on February 18th. Yep. Celebrating 17 years. I can't believe it. We were just kids when we started this.
Believe it.
Right?
No.
So we have a special this month. Get 17% off your cosmetic services. Now, it doesn't include packages and series because those already have a great price. But February 1st through February 18th, 17% off all services. And all month long, 17% off your favorite skincare products. We've also got a date night glow available because guess what? It's also Valentine's month. Get 20% off a Neoskin and a BioRepeel combo. That's a nice mix. I love it. You don't have a lot of downtime with it. Your skin looks super hydrated, glowing, looks a little taut. Who doesn't want that? Glowing, radiant skin for your Valentine's Day date. Valentine's Day is on Friday. So,
your Galentine's.
Yeah, your Galentine's, right? And then out with the old and with the new, we've got 20% off 6-day detox kits as the new year brings resolutions for all of us to get healthier, right? Who doesn't have that on their list? So a lot of great specials this month. And we thought what we would do is help you guys get to know Melissa a little better because we know her and we love her. She's been with us 3 months now. And then we'll talk about what's been going on the last 17 years, what's changed.
Yeah, like how far we've come.
Yeah, exactly.
Yeah, that's why we got all this stuff around here.
I know, it's so fun. I feel like it's Christmas all over again.
So Melissa has been here for 3 months, and we are so excited to have her. You have been an amazing addition to our practice.
Aww,
yeah.
So, I feel the same. Thank you.
Yeah, we are super excited. Our patients are loving her, and for those of you who don't know, she is our newest member as an aesthetic nurse injector, and she's fabulous. Truly, folks, amazing. Patients are absolutely loving working with you, and we love working with you. So anyway.
And Melissa's here on Wednesdays, Fridays, and 2 Saturdays a month.
Yep. Though your schedule is filling up pretty quickly, I can tell.
It is.
So that's awesome. We've been keeping her busy. I love that too. It's awesome. So there's a lot of changes over 17 years. We've had products and services and things like that have changed over the last 17 years. And we thought it would be fun to bring in Melissa because she's new. But hopefully she won't be new for long. She's going to be here for like a lot of our staff forever.
Yep.
I know, I keep saying that.
I'm going to be here 80 years old in the back office with a bag over my head, you know?
Janet, how long have you been here?
17 years.
Me too. Yeah. So a lot has changed, but a lot has stayed the same.
Yep.
And we thought we would just use this time to talk about that.
Yeah.
Because it's been a crazy ride.
Yeah. And feel free to chime in, Melissa, because even though you've only been with us for 3 months, you're not new to being a nurse. You're not new to aesthetics and injecting either. You've been injecting for how many years now?
Ooh, almost 5.5 years.
Okay, great. And then you have a little side gig, so to speak. You have another job. You wear a different cape.
I do wear another cape, yes. So I work at a local hospital, and I work there 3 days a week in the pre-op and recovery room area.
Okay. So that's why you have such a fabulous touch, right?
Yeah, it's a lot of years of experience. 38
Wow.
in nursing.
Yeah.
Wow.
I
That's
know.
awesome.
You don't look old enough to have
I
had
know.
38 years of
She
experience.
became a nurse when
All
she
the
was a
things.
child too.
Anything. She's a
All
child
the
prodigy.
things. I share too. I share what I know.
That's why
Secret.
patients love you.
Yes, I mean, she walks the walk and talks the talk. So we have a whole bunch
Yeah.
of goodies here, and as we talk about them, I would love to hear your take on it,
Sure.
Melissa. Like if you've got some favorites, tools in your toolbox that you like to use. But Janet and I were talking, we were just reminiscing, which is how we came up with the idea of what to talk about today, about when we first opened 17 years ago, like what did the aesthetic landscape look like? And honestly, we had 2 neuromodulators, but in our practice, we actually only had one, and that was Botox, like the OG. And Dysport was available, but not widely used at that point. I think it was a few years later that we finally brought that into our practice. So we had just these 2. Now we have 5 to choose from. We've got Xeomin, Juvo, and Daxify is the most recent addition. And there are newer products coming soon, so stay tuned. There's going to be even more market competition, which is nice because it helps for pricing, having a little bit of competition there. And then different properties to the products as well. So there's some exciting changes on the horizon. When we started, we had these 2 dermal fillers, and that was it, Juvederm Ultra and Ultra Plus. I think that Radius came shortly thereafter as another option, but this was it, folks. So it's been a kind of a crazy ride and a lot of learning over the years. And then we brought in Restylane and Perlane were again available when we first opened, but we didn't bring those on for a couple of years. Perlane is now known as Restylane Lift. We used so much of that, we actually ran out, so I couldn't even put that out for you to see today.
Yeah.
But Restylane and what is now known as Restylane Lift have been out for a little while, but that was it. Now we have Restylane Refine, Define, Kiss. We have Voluma, Volux, Volbella, Velour. We don't have that out right now. We've got Skin Vive, which is the skin booster type hyaluronic acid injection to help more for superficial texture and glow.
Yeah.
We still have Radius, but we seem to be using that a little differently these days. We like to make that into something called hyperdilute Radius, where we blend that with saline into a slurry and use it more for its collagen stimulation properties.
Yeah.
And then Sculptra. And Sculptra we started using, I think, in 2014. It had been out for longer than that, but I think it's actually becoming more and more popular as time goes on. Seem to be doing a lot of, that's going to topple over. We seem to be doing a lot of
I like
Sculptra
Jenga.
treatments.
Jenga.
So I had someone ask me, and you asked me, like, what do we think? Why are we using more Sculptra recently? And I think that there is definitely a push for more natural results. I don't know if you're seeing
100%.
that, Melissa. But I think there's more of a push towards these regenerative treatments and natural results that we can achieve with those biostimulatory treatments, like Sculptra, like hyperdilute Radius. We also have Renuva. I didn't even bring that out. We have that. Renuva is the connective tissue matrix around which we build fat.
And Arias.
And Ariescence, platelet-derived growth factors. I mean, things have come a long way. We used to use PRP, then PRF, and now we have Ariescence. I think, things have evolved over the years. But going back to Sculptra and why I think we're doing so much more of that now than we ever have, I think one is the push for more natural results, but 2, I think the GLP-1s have something to do with that. Everybody and their mother is on semaglutide, Ozempic, tirzepatide, and I think people they like their slimmer face, and I think in the past we were using some dermal fillers, myself included, to give more angles to the face when it was rounder, right? And it has a slimming effect on the face. But now that people are slimmer in general, they don't really need that. And I'm finding they're going more for the hyperdilute Radius and the Sculptra. Are you seeing that?
I definitely see that. We're kind of getting away from the pillowy face.
Yes.
The overfilled. We're just trying to make you look like you had a great vacation.
Yeah.
Best sleep ever, and just about you turning back the clock a little bit.
Do you have any favorites amongst the group?
Oh, it's hard to call a favorite on them. I really do enjoy Lift and Voluma. I love a good cheek. In fact, that was the first filler I ever had, was cheek filler.
Yeah.
Yep.
And I
think
would
a lot of
say we lose it there first.
Right, because we start to slide down, right?
We sure do.
Yep.
We do.
What about for lips? What do you like to use in lips?
We've been using a lot of Kiss for lips, and I
Yeah.
think that's absolutely beautiful.
Yeah.
I would say that's the latest fave. However, I like a nice full bellow lip too.
Okay.
I
And
do
that's
too.
like more for smoothing, would you say?
It would be more of that natural hydrating look.
Okay.
If you want more of a Kylie Jenner lip, like a more pillowy lip, then we would go some Juvederm and
Yeah.
do that if you want a little pillowy lip. And I would say the younger gals really like that one.
Yeah,
Mhm.
I totally see that as well. I think either Juvederm Ultra or Ultra Plus, depending on how far they want to go with their lips,
Yes.
Yeah.
can be a nice choice for those patients. I think for the patients who want a very natural look, I think Volbella is great. Kiss is for that in between. Like they need a little bit more volume, but they don't want to look unnatural and too
Exactly.
pillowy.
I like the way Kiss feels because it's like your natural lip. You
Yeah.
know?
Yep.
Yeah, that's pretty.
It is really pretty. How about Skin Vive? Are you finding yourself using much of that?
We actually have been using a fair amount of that. Again, going with the natural trend that we're seeing is people like the idea of just boosting their skin quality. And of course, we live in Arizona, the desert. We are dry to start with. We're behind the 8 ball on all of that. So I would say, your skin quality is going to be probably the number one for anti-aging. And so I'm seeing a lot of the boosters so that we keep our moisture in our skin and the great skincare that we have too, line-wise. You really need to have a lot of that living in the desert.
Yeah.
I see that too, and I also see Skin Vive being used by patients who maybe don't have time for downtime and they need improvement in texture and fine lines and wrinkles, or acne scars or whatever, and they can get an immediate result with Skin Vive. You see a change immediately, but over the 6 weeks after the treatment, it gets even better. So I find that patients who maybe shy away from devices or microneedling or whatever, they like the Skin Vive quite a bit.
Yeah, absolutely.
Do you have any favorites
quick
from
and
here,
easy.
Janet?
You know, I feel like I kind of hit on them. I like Kiss for the lips. I do like Lift in my cheeks. And I haven't experimented enough with Skin Vive and Sculptra.
Well,
Ooh.
And then Dysport is my favorite neuromodulator.
Well, we found her next treatment.
Yeah.
in our practice, believe it or not, and this was even a surprise to me, we ran some numbers, Dysport is our number one neuromodulator. So by far, like 40% of our patients are using Dysport, 25, it's almost a tie between Jeuveau and Botox, 25% each, and then the rest is Daxxify. So I was really thinking, wow, we don't use a lot of Xeomin in the practice, mostly because when we brought on Daxxify, I think we had a lot of options, and almost too many options can be confusing for patients. So, so we don't use as much Xeomin, but we're using a ton of Dysport. It's my personal favorite neuromodulator. I love it. I love that it works quickly. I mean, I had a treatment 2 days ago, and it's already starting to work. It lasts, I think, a little bit longer than some of the other neuromodulators available. They've done potency studies on all of the neuromodulators, and it is the more potent product. So even more potent than Botox, interestingly. So just something to think about. If you've never tried Dysport, give it a go.
Yeah. And is that why it lasts longer?
I think so. Dose and duration go hand in hand, and Dysport is dosed differently than some of the other neuromodulators. So, like for example, we dose pretty much these 3 products all the same: Jeuveau, Botox, Xeomin. Whereas Dysport, the molecular weight is a little different, and we dose it 3 times as many units as we do the others. So, but 3 times as many units is should be roughly equivalent to 1 unit of the others, but I think it's actually a little bit more.
Okay.
I do that in part just for ease of use, because this comes in a 300 unit vial and these are 100 unit vial, and that way I inject all my products the exact same. There's no confusion. I think keep things simple is just better.
And the pricing is the same. Like it all comes out in the end.
Exactly. 3 units of this is $12. 3 units of this is $12. So So it keeps things, I think, more consistent.
Mm-hmm.
But I do think that because we're using a little higher dose, like some people might do 2.5 times as much. I use 3. So I think maybe that has something to do with the longevity.
Okay, yeah, because it lasts me longer too.
But quite honestly, if you dose and duration go hand in hand. So if you use 2 times as many units of Jeuveau, you'll get it to last longer. And that's interesting why when Daxify came out, their recommended dose to get the longer duration is 2 times as many units. So
Right.
they'll argue that maybe there's other properties to that product that's why it lasts longer, but I do think that the dosing has something to do with it. Yeah. Okay.
Unfortunately, though, these ladies will help guide you, so you don't have to decide which one.
Yeah, don't worry about that.
Don't worry about
Don't worry.
that. They'll help you.
And-
Same thing with the filler, too.
Some of it comes, excuse me, I think I inhaled my Riesling.
boy.
Some of it has to do, that's because I'm talking, with, you're going to have to edit this out because now I can't remember what I was talking about. Some of it has to do with deals, like manufacturer rewards and things too, because I think sometimes we choose things because something's on special or the manufacturer's offering a reward or whatever.
Because they're all great products.
Yeah,
They are.
and
Right?
they're all FDA approved, they all work, and we can adjust them. So honestly, all of them will work similarly depending on how we modify them.
Yes.
Okay, so besides injectables, there's been other changes in the practice.
Mm-hmm.
So that's why we brought all of these devices out here too. So we've got a couple new things that we didn't have 17 years ago. So when we started, let's reminisce, Jenna.
Yes.
When we started, we had 2 devices in the practice. We
The
had
Elite and the Affirm.
the Elite and the Affirm. And those were 2 Cynosure devices. The Affirm did non-ablative laser resurfacing, kind of like Fraxel. And then it had an IPL attachment. So we could do photofacials with that. And then we had the Elite, which allowed us to do some little brown spots, red veins, and hair removal. And so that was it. That's what we had. We had 2 devices to start. And I do advise people who are looking to get into this industry, this industry is like crazy, growing, insane. Like when we opened this practice, we were the only med spa for miles and miles and miles. And now there's one right across the street and down the street and everywhere, there's probably one right in our backyard. So somebody's injecting Botox back there. And I never discourage people from going into the industry because I feel like there's enough faces for everybody. At some point, maybe I'll feel differently, but I feel like it's grown like crazy. But in a good way. I think there's been a lot of really great developments in the aesthetic industry, a lot of new technologies. And so after we started with those 2 lasers, we then brought on a CO2 device. I quickly adopted CO2 and have loved it for 17 years. So maybe 16 years because maybe we got that a year in or something.
Year in.
And I have absolutely loved it. We now have this device, which we brought on a few years back. We replaced our original OG CO2 with a very similar one. It's similar. It's actually made by the same company in Europe or Israel or wherever these things get made. I feel like that's where everything's from. So this is the Smart Side Tetra by a company called Deca. We love it. It allows us to do the cool peel, which is a lighter, more superficial resurfacing, like a peel. Is great for brown spots and fine lines and texture. And then it also allows us to do the deeper CO2 laser resurfacing for deeper wrinkles, for skin tightening and things like that. Beautiful results that we see with this.
This
for
is
rejuvenation.
my all-time favorite.
Yeah. I feel like if you're over the age of 50 and you haven't had a CO2, you're really missing out. You should do that.
Fine lines, wrinkles, pore size, pigment.
The results for pigment are insane.
Yeah.
So I love it.
Texture, improving texture. Imagine doing something like this and then adding the Skin Vive a couple of weeks later.
Sculptra, all the stuff.
Sculptra, replace some volume that you've lost. And one thing that we like to do too is have people have their, Botox or Dysport, Jeuveau, whatever, their tox a couple of weeks to a month before we do the CO2 so their base is at rest and they get better results from their treatment because as they're healing, they're not making those, strong repeated facial movements that are etching in all those fine lines and wrinkles.
Yep. Yeah, so I love to do that.
Yeah.
The other device that we brought in a couple of years ago was the Morpheus 8. Morpheus 8 is RF microneedling. We did have an RF microneedling device before that. It had a predecessor.
Yeah.
And we had other RF devices in the practice. But what's really great about the Morpheus 8 is it allows us to really have more adjustable settings in depth. So you can go superficial for really sort of light resurfacing, and you can go deep for even helping for fat in the like segmental area if you've got fullness there. It's a really great device. It's got a lot of buzz online, and we're really liking it. The device is great for acne scars.
Yeah, definitely.
For skin tightening, texture, that kind of thing.
Yeah.
And it really has no downtime.
Right. And I like to do a CO2 and then have Morpheus 8 done as a follow-up for maintenance and to get a little bit more of that skin tightening because you'll get more skin retraction with that.
Yep. Yes.
So I think those two work well like for maintenance.
The other nice combo is doing the superficial resurfacing with Cool Peel and then doing the Morpheus 8 same day. It's kind of nice. You'll have a little more downtime,
combo treatment,
but it's a great treatment, great combo. Yeah. And then most recently we brought in Elicor. Elicor is a micro coring device, so that's actually removing skin, thousands of little cores of skin. Great for jowls and lower face tightening. We're seeing amazing results with that. I love to combine that with the CO2 same day. I actually think the healing is faster when you combine them for some reason. I don't know if it's just the cell signals or whatever is happening when we combine them. Seems to work in concert with one another. So you're getting resurfacing on the skin that's left, and we're removing some of the excess skin for tightening. Amazing results that we see with that after just a couple of sessions. Yeah. But there is a little bit more downtime, when you start combining things, but you can get further faster. Right. For sure. So we've been doing a lot of those in the practice.
But still, the downtime is only about a week or less.
Yeah.
Truly.
Yeah. You can put makeup on after 4 days. So it's just a matter of how much you want to hide, from friends and family.
Right. Your redness or your pigmentation. Yeah.
So loving all of these new technologies.
Yeah, and there's more, but we just couldn't fit it in here.
Yeah, I mean, then we wouldn't fit in here.
Right.
Yes, right. I mean, we've got IPL, we've got for photofacials, we've got the Neoskin NeoClear, which is a great laser facial type treatments for acne and anti-aging. We still do laser hair removal. We have the Hydrofacial that we've had for years. Yep. Still loving that.
Plasma pen
for fine lines and wrinkles if you're really targeting smaller areas. Those are great, especially like around the eyes and smile lines and things. Microneedling.
Yep.
Regular microneedling without the RF. We've got the Exceed micro pen.
Yep.
Yep. So we have
made
that.
in Germany, just like the wine.
One new thing that we didn't have 17 years ago was exosomes.
Right.
We are now using exosomes. I love to apply exosomes anytime we are ablating the skin or making channels in the skin, microneedling, CO2, RF microneedling. Those are the cell signals that get sent from cell to cell to turn on cellular functions that get turned off with age. So that's great. The Clear and Brilliant.
Yep,
Clear and Brilliant. Yep, we've had those around for a while. Still loving them. You can do them in combination. There's two laser wavelengths. One is for more anti-aging. One is for more pigment. You can do them separately or together. Great treatment for little downtime.
Yeah, absolutely. So we have a lot of fun stuff here in Paradise.
Yeah, we're definitely not a one-trick pony. Yeah. So we have what you need to get you the results that you are looking for. I highly recommend, if you're not sure what to do, where to go, just schedule a consult with me, and we will make a plan that's specific for your needs. I love to meet new patients and sit down with people and really make a goal for them, knowing all the tools that I have in my toolbox.
Yeah, and we take all the guesswork out of it for you.
Yes.
In doing that.
Yep. Have you tried any of the device type treatments in the practice yet?
Cool peel.
Yes. How did you like it?
I love the cool peel. I thought that was fantastic.
Yeah. You can't go wrong with a cool peel. Love, love, love it. If you've never done one and haven't done any kind of device treatments, any resurfacing, I usually recommend starting with a series of 3 to 4 treatments, maybe stacking the initial set of treatments and then doing some maintenance every 3 to 6 months. Yeah. Because we're not stopping the aging process.
Unfortunately, right? Yeah. And then like with the CO2, that's something you're going to do every like 2.5, 3 years.
When you do those deeper treatments.
Yeah, exactly. And EllaCore, usually we can accomplish what we need to accomplish with 2 treatments, done about, 6 to 8 weeks apart. But the skin doesn't grow back, so, you know.
It tightens up. I think, if you are really a facelift candidate and you're trying to avoid surgery, you might need a third EllaCore. But if you are doing this, if you're not that far along, then 2 treatments usually is sufficient. I'm typically putting my setting on around 7%, so I'm removing 7% of the skin in the treated area. Yeah. So if you do that a couple of times, you're at about 14%, if you do the math. And that seems to be sufficient enough to get patients the results that they're looking for.
Yeah. And what else I thought of that we didn't have initially? PDO threads.
Oh, yeah.
So, right?
Yes,
talking
PDO
about
threads.
doing a little bit of subtle lifting, maybe a little defining of the jawline, using it in combination with some filler.
Talks.
Yeah.
Patients love, love, love PDO threads. And it is a quick fix. So you see immediate results, beautiful results, and it stimulates collagen. So it's another nice sort of regenerative treatment that you can benefit from an immediate improvement, but then some longer term changes.
Yeah, absolutely. And I think we've been offering those since like 2013.
Yeah, a long time.
Yeah.
That's great.
Yeah, they're fun. They're fun.
Yeah, we have patients that ask for them every year. They're like, Janet, my face is falling. I think I'm ready for my threads again.
Yeah, they seem to last about a year. It seems like oh, it's done.
Yeah.
Yeah, and patients, like I said, that's one treatment that I feel like once you've had it, patients love it. They're always coming back for that. Yeah, they absolutely love it, and it's quick and easy, and there's really no downtime.
Yeah.
So
and it's safe too.
Yeah. It is. It's come a long way. I think when threads first came out, which is why we didn't do them like right away, they were not absorbable. They had some challenges and they were taken off the market, and then some newer, better technology came about, and now they're perfectly safe and in the right hands. So yeah. Okay, well, fun.
That's really nice.
Talked about a lot of stuff.
I know.
Well, we're so happy to have Melissa. I encourage any of you who are interested in filler, talks, any of that, aesthetic injectables, to schedule an appointment with her. She's amazing. She did my treatment the other day, and I'm loving it. And I think she's treated a bunch of our staff and lots of our patients, and so everybody seems really happy.
I'm getting in her chair next.
Yeah, yay. Yep. Well, thank you, Janet. Thank you for 17 years.
Thank you.
Thank you for 3 months and many more years to come.
Yes.
Yeah. It's exciting.
It is.
Thank you all for joining us, and we will see you next month.
Yep. Happy Valentine's Day.